These are the activities we conducted during the period under review. Number one is we participated in all procurement committees meeting. Prior to the pilot, that does not used to be the case, but as the pilot kicks up in January, the quality assurance and quality control team was deeply involved in all processes of procurement throughout the transformation project. Then the second activity we did is that we instituted quality assurance processes and inputs into product selection, quantification, procurement of commodities right from January till date. Second activity we conducted is warehouse staff trained on quality assurance SOPs. Before the pilot, in fact, quality assurance was not given its rightful place when commodities are received into the agency. For instance, staff right from the gate, that means the security men have been trained, on how to inspect vehicles that bring products into the agency. If a vehicle is not compliant in terms of quality in delivery, in fact, right from the gate, the vehicle is stopped until the supplier conforms to some of our SOPs. The fourth activity we undertook as a team is to institute quality assurance processes for receiving of all commodities in the warehouse. Before now, or before the pilot, in fact, it used to be at a very dismal, measure, because most quality checks were not truly carried out. But now we have an SOP for the receiving of all commodities into the agency to ensure that our products maintain quality, not just at the warehouse, even after leaving the warehouse to where they are meant for use. Then the next activity we undertook was to review quality assurance focal work plan. Since October 16 to 20, where, after the deployment of our coded prescriptions, we realized that, facilities didn't deploy it immediately. In fact, we have to go to mentor facilities on the use of and filling of the coded prescription sheets. And, after the mentoring, we did the mentoring in facilities within Kaduna, and those outside Kaduna, we had to use our, WhatsApp platform, to keep them updated. And after that activity, in fact, the result was very encouraging. That goes a long way with the next bullet, which is equally the mentoring that I've just talked about in the last bullet. Then the next activity we did was the steering committee saw it as a point of need for a unified selling price list for all the health facilities in the state. And that has been done right from November and is being uploaded into the state website. That has given even patients in their home to be able to cost their prescriptions if they know what will be written for them in the hospital, or if they are going back to refill prescriptions, that they are using in managing a particular condition. Like diabetes, we know if you are managing diabetes or hypertension, your prescriptions do not really change over time. So you can even sit in your bedroom and cost your prescription before going to the hospital. So I feel that's a very landmark achievement for the transformation project. Then the last but not the least activity that we undertake is a monthly update of the unified price list. Spot checks are conducted on all batches of commodities received. I think that I've spoken about all commodities that are received into the agency. In fact, we ensure that spot checks are carried out, to ascertain their quality. First, we check for NAFDAC registration number. We know that NAFDAC is responsible for, ensuring that all pharmaceuticals that gets into the country and that are distributed across the supply chain maintains quality. So let's go to achievement. Some of the achievement the team achieved was the procurement process, to ensure that procurement process meet quality assurance and quality control standard. 2 was an improved capacity of the receiving committee on quality assurance through training. Then quality data increased. That is, I've just told you the monitoring that we did on facilities after the deployment of the coded prescriptions, and after that we saw a tremendous, improvement in the way that prescriptions were being filled to make it sensible, for the control tower to use for, for planning and to make informed decision. Then transparent pricing regime was established, just as I've said, due to the price list development and publication. Let's go on. Next slide. The weighing scales, just as the procurement focal area made mention that we've procured 2 digital, weighing scales for the agency. That has made it possible for our 3PL to know the volume of tonnage that they are delivering to a particular facility. But as it was mentioned during the warehousing and distribution, in fact, the peak slip for facilities still do not bear weight and volume, but we are looking into that so that 3PL will make an informed decision to know the kind of vehicle they are bringing to convey commodities to particular, health facilities. Then the next achievement is approval for procurement of a quality control equipment and mini lab was signed in December 2017. That's in our budget for 2018. The procurement focal area made mention of that. That is going to be a landmark achievement for this team, because whatever we are doing in this project, if quality of our product is not assured, in fact, all our efforts have gone down the drain. So this one is going to be a landmark achievement for not just for the team, but for the state and the agency at large. Challenges: inability to determine volume of dimensions. For now, we are just doing trial and error because we are using crude method to measure volume by using rulers and tapes. So we are looking forward to getting vernier calipers for precision, as we work towards obtaining a gold standard in our supply chain. Next challenge is difficulty in coordinating QA and QC team members. In fact, that led to the fact that we scheduled in our work plan during the August meeting that we are going to pay advocacy calls to NAFDAC and Kaduna State University to collaborate in areas of quality assurance and quality control. But due to this difficulty in coordinating team members, that has not been done, is still pending. Quality is paramount. Lesson learned. Quality is paramount in pharmaceutical supply chain management. Just as I've stated earlier, in fact, if the quality of what we are delivering to health facilities and to our patients at the end is not of great quality, then all the efforts we are doing that we're sitting here today are all in vain. Then
we noticed that when the January price list came, some products that are the same had their code changed. And that kind of caused some destabilization because some of my pharmacies used December codes to send SMS for a product, only to discover that the January code has changed. I don't know what you people are doing to make sure that products that are already on the list retain their coded figure, if possible. Then secondly, the price list you bring to facilities. My facility has over, let's say, 5 dispensing points. When I say points, I mean dispensing points. And you give me 3 price booklets. to duplicate them is very cumbersome because I don't even have access to A4 paper, this, that, you know. So it's very difficult to reproduce for every cubicle or every dispensing point, sorry. And these prices, they need to be there at the dispensing points. I don't know if you could look into improving maybe the quantity you send to facilities, especially a facility like my own. Thank you.
So let me respond to my Oga's question. That's Pharmacist Gaura. For you to say that, you know, costs were changed from the various price lists, in fact, it's very surprising. But if you look at the December price list, in fact, the products were arranged haphazardly. But as from January, we tried to sort them based on dosage form. I want to believe if what you are saying is true, then I believe it was in the process of rearranging these products to make the price list more user-friendly that makes us, you know, to interchange or to skip, you know. So we'll still look into that. We'll liaise with LMCU to see if your claims are true. Okay. I think that's a decision of the steering committee. Decision of the steering committee, but we will look into that in the nearest future to see that. For now, secondary facilities are given 3 copies per facility, while primary healthcare centers are given 1 copy. But we'll look into it to see that if that's truly inadequate, in the nearest future, I think we will buffer the quantities, you know, for you guys. Then for Mrs. Bako's question, I thought my Oga, the director, DLO, has responded to the selling price that comes to you in that booklet. If you look at the column, is selling price, is what you charge the patient. But what comes to you in your invoice is the cost price. Okay, but I cited an example that amlodipine 10 milligram. Yeah. In the selling price, it's written 35 naira something. So while the invoice that they brought is 11 naira plus. Have you worked out the additional percentage? The difference is very clear now. It's too much. In fact, can you give me the code? Maybe later we'll sit down and check at those.
Thank you. Somebody asked the question while you were not around about the alphabetical listing, that there were 1 or 2 products that, you know, did not line up alphabetically. And that means, of course, when you're looking out for it, you won't get it. I don't know. Somebody at the back, I just noticed that hasn't come in. And it's very important because you need to be able to locate what you're looking for in, you know, such a multi-dimension list like that with the alphabetical. True. Maybe you would know what happened. Well, just check again. Yeah, maybe we will check. We will check much later. We will check much later to see if truly your claims are horse water.
Very brief. Well, project management is the mother of all the projects, so that's why I'm coming last. And then I'm just going to, since it's the overarching, so it's just going to be like a general overview of the whole project. So for the project now, you know that even the pilot is even a project. So for project management, it has to look at all the activities of the pilot, bringing out the phases. So from the overview, in the pilot, we actually had to design the pre-implementation, that's the pre-pilot, then the implementation phase, and the post. And then from the pre-implementation, we actually had the pilot facilities that were selected, and then it was then that we actually chose the model for the pilot. And then we had to, when we sat down, we had to look into looking for the steering co, because for any project to be successful, there has to be a steering committee. And the steering committee was not only from the DMA, it cut across all quarters. We had the DMA, we had the SPA-CDA, we had even the Ministry of Health being steering co members of that committee. So, these are actually, those activities are actually activities that were already reported in other focus areas. But then we'll also look at, because project management monitors activities, so we ensured that there was the dissemination and development of the quarterly project report was disseminated, 3 reports from Q1 to Q3. And we know that for every focal area, they have their own milestones. So we know that project management is supposed to have like a dashboard of milestones for each of the focal area, and then follow up to ensure that each focal area keeps to their timelines. And that was what was done. And then I'm sure from human resource, they heard capacity gap. So when we discovered that there was capacity gap, there was the supply chain management training for all the supply chain transformation team members, so that we'll be able to know how to carry on our duties well. And then we ensured that, well, for every focal area, you must have a standard operating procedure. It's more like a manual guiding your operations. We know that when there are no SOPs, everything is just done haphazardly. So we ensured that every focal area had an SOP. Next slide. Okay, and then all the things we were doing, we're not just doing it in isolation. You know, everything you have to pull from the national supply chain. So we ensured that we pulled and domesticated the national supply chain performance indicators, domesticated, and that was what we actually pulled out and we are deploying. And then, as I said, there was a clearly set out supply chain transformation project, which was divided into the pilot. That's the pre-pilot, the pilot phase, and the post-implementation phase. And then, as we kept on going, we know that it's a pilot. So if it's a pilot, it's a test, learn, and do. So as we kept on doing the pilot, where there were issues, we went to the steering co, looked for solutions, and then we retested new models. So it was a test learning activity. And that's why it's showing that it's actually a responsive pilot. Anytime we encountered issues, we tried to do something about it immediately. So we don't wait till the end of the quarter before we resolve those challenges, but we actually resolve them immediately. Okay, well then, also part of the achievement, there were lots of advocacies for each of the pilot areas. So each pilot area that had issues or policies that needed advocacy, we actually set the guidelines and ensured that those advocacies are done and properly done. Well, there were conventions that were done, which was like vaccine analytic network. Vaccine that having visibility and visibility of all supply chain activity has actually been a challenge, not only in Nigeria, but other countries. So there was actually a conference, a workshop in South Africa, where different countries having similar supply chain issues were brought. And then there were also private, public people that came, those that had perfect supply chains, those that had weak supply chains. So those that had weak supply chains were able to relate their issues, and then those that had good supply chains were able to provide solutions. And I'm sure even this, our transformation project, was also presented at that conference, and then they gave solutions. And funny enough, or surprisingly, what we are piloting, the solutions we are actually piloting, actually matched what other people that are actually good in the supply chain gave. So we now saw that actually the pilot is actually going in the right direction. So following that convention, there is the SOLVE, which is a quarterly workshop that helps us to monitor our key performance indicators. And so far, every quarter we go to review these KPIs, we found that we're actually progressing positively. So actually, that's what I have for the project management. So we had challenges, and the challenges were capacity gaps of the project management team. We know that project management is more like a new concept. People do project management, but not as a distinct unit, but as it's embedded already in the project. So there are actually capacity gaps of people in the team to actually be able to monitor the progress of all the supply chain and components of the project. So lessons learned, that is the need to define project management within the supply chain transformation project. That means having a dedicated team that will look into the affairs of all the focal area to ensure that they are all keeping their timelines and the action points being brought out and ensured and followed up to ensure that they are done. So it's also important to track activities regularly to avoid loss of data, information, and activities, and then following up with timelines. Well, thank you. That's the end.
What you know about the before the pilot, that is the baseline. Then what you know about it now, then probably possible scale of want to fill your pause. So we're going to start the grouping now. I think we'll take the first 8 table here and share the group. 8 table will be the group. Then the other 4 will just...
Because the group can go around the whole place. What I was thinking is we take the numbering, MDs, CMDs, others 1 to 8. Then, yeah, there was supposed to be 10. There's supposed to be 10, I think.
I've not seen some of the MDs.
Yeah, so let's see how it goes. I mean, it's supposed to be 5, yes. 5.
So you may not go around.
Yes, but you see, you have accountants. Yeah, so accountants are supposed to be 5. Okay. So why don't we just start? So we were to have finished this group work before lunch and then come back for another just slight introduction to what scaling up means and do the group work. But now we're going to do the 2 group assignments together so we don't, dissolve the group and come back. But we need to make sure that we have groups that represent, around the, technical competencies that are here. So please, if you don't mind, let's start from the CMDs, MDs, here. So if we just number 1 to 8.
Community health.
And the in charges, yes, please, the in charges. So please, if you are either CMD, MD, in charge, anybody in charge, both of course technically and administratively, in charge of the health facility, please can you, if you don't mind, if you can just put up your hand and then we number 1 to 8. Thank you, sir. 1, 2, 3, 4. Okay, no problem. So 1, this, what number, sir? Yes. Okay, thank you. That's done. Then accountant, in charges, please. Okay, so we start from 3. We start from 3. 3, 4, 5, 6, 7, 8. Then we start from 1 again. All in charges. The concentration on this is that a very significant part of the presentation is what we want to address this afternoon. That is the baseline. How was the situation in that focus area before the pilot started, before the transformation project started? You see that all the presentations started with activities, achievements, challenges, lessons learned. But the issue is there were situations that led us to the formulation of this transformation project. So it's not only at DMA level, it's not only at SMOH level, but also at the facility end. What was the situation with your data visibility? That is casting our minds back to 2016 and before. What was the situation with quality assurance of your goods? Was anything happening for you to be able to quality assure the products you are bringing in? What of even leadership? Leadership for supply chain. Those are all the things we want to put your minds together. In each of the focus group, you find your place and give us an idea. Again, recollecting back, and I know that's sometimes a little difficult when you've gone forward to go back. But then we want to tap our minds again so that when the story of this transformation project is being told, we can have authentic evidence of how things were before we started and how we have moved on in the pilot. Then apart from doing that, we will also update anything in the slides concerning achievements, concerning challenges, concerning lessons learned that may not have been captured before. We envisage that this should not take us more than 20 minutes to do in each group. So as much as possible, let's be concise. If you know something is already captured on the slide, please, you don't need to say it again. Anything that you say must be what is omitted from the slide right now, and then you discuss, and then we can put it. We suggested putting in the new inserts in bold red, so that we will know that whatever we see in bold red font means you have just inserted it in. I don't know if we get that. Anything we insert anew, let's just put it and color it bold red so that we know the update. Thank you. So that's a very easy group work. 20 minutes, 25 minutes at the very most, we should be done. And then we'll come up and just say the additions alone. Please, we can't repeat what we've been doing all morning. So anything that we have just inserted is what we will present. But we're presenting that first one slide, and that is the baseline, the situation at before pilot for the 8 focus group areas. Please, is there any issue, any problem, any clarification? So we understand. Do we understand, please, what we're to do? Thank you very much. At the risk of, okay, you can now put the presentation. So just for us to save time in moving between group and coming back, I want us to take a very small presentation that will usher us into the other group work. We have been saying it since the beginning of this workshop that our next step is the scaling up of this project. So I just want to spend a few minutes in introducing what scaling up a project means, so that when we go to the next group work, we will all be speaking the same language and have a fair understanding. Now, again, just for us to remind ourselves, the very name pilot, once you say pilot, it means you are doing a trial run. It means that it's a small-scale version of a larger project. So very soon, we're going to talk of the SCTP and stop talking about pilot. We're going to be talking about the state transformation project. So now is a very important step that helps identify potential problems. So what we had started saying again is that it's now the time for us to establish any issues that can give us a problem in the scale-up version, so that they will not escalate. And suddenly we now have 50, 100 facilities and everything seems so difficult. This is the chance we have to, to confirm our readiness for full-scale implementation. And that's what the second group work will be about. Next slide, please. So what's scaling up? Scaling up refers to deliberate effort. You see, most times we think scaling up is inevitable, something you just move into like a stream of water, you start. No, scaling up means you come apart again. It's a definite step. It's not something you slide into. It will need assessment of what you want to do, how you're going to do it, the resources you have to do it, all have to come in a scaling up. And that's so we want to see how we're going to benefit more people. As we said, everything about the transformation project is about the patient, it's about the people. So the people are the core of our discussion, not our program alone per se, the people, the target. And now we see as we go into scaling up, the people have a bigger scale. Scalability is the next thing. We want to see, we've done the pilot of the SCTP. Is it effective now and will continue to be effective when it's larger? You see, because some things can be effective when it's small. You can manage a few things when they're small. But when it enlarges, when it expands, do we envisage that under real life conditions, we will still have that same measure of success? That is what we want to discuss in our group work, and that is what we're doing now. There are 4 phases of scaling up project. We are just going to be on step 1 today, but I just thought I would line this up for you, and probably we have a way of sending this to you, so we know what is, what is ahead of us. So next slide is what we're going to do this afternoon. We want to assess the effectiveness of our pilot. We want to assess the potential reach and adoption. Reach means all the people that are likely to be, brought in. And adoption means their readiness to accept the SCTP, you see. Then we align the SCTP with the state. We've been told, make Kaduna State great again. That is Kaduna State. Our health, plan, Kaduna State plan, we have to make sure that the SCTP is lining up with it. And then, check how acceptable the SCTP has been, how feasible it's been. Is it difficult to implement? Does it present threats of something of such great magnitude and, like a disturbance? Those are the types of things we want to, but we know that by the end of the day, we just have discussions on the table and present. So this is what the next group work is about. Immediately we finish that first one. Please go back so that I can. The second part of it. The second presentation. The one I started with. Good. So the next group work we're just going to have points that we're going to discuss, and those will be given to each group. We will come round to each group and tell you what we're going to discuss. Please, is there any question about group 1 work or group 2 work? Are we fine? So happy deliberations. Thank you. About 20 minutes for the first, and about 30 minutes to 35 minutes for the second. Then we just come back, and 5 minutes we just present. And that will be all. Please bear with us. We started a little late.